knows all about it. That's her
Oh, hi,
favorite thing.
Carmen.
Oh, good. Thank you.
Right there.
They're like 10,000
Sorry,
years
Karen, I don't
old.
have a
It's
camera
just,
on
if you
us
just
today,
drive
but,
straight north from Vernal
we'll
through
let you know
Flaming
who's in the room
Gorge,
here.
Melissa,
it's just
we're
right up
live.
off
Okay.
That is
Teton.
cool.
Great.
Okay, guys, we'll go ahead and get started. So let's just go ahead and go around and do introductions really quick around the room. I'm Melissa Moore. I'm the director of the health department.
Barb Schaefer,
Board of Health member.
Board of Health member, sorry. I'm Katie Adams, I work at the health department.
Dr. Jeffrey McEwen from Teton.
Melody Renson, Sugar Cantha.
Gary Dale, health officer in name.
Laura Weir, board member and former Teton County Health Department director.
And go ahead, Carmen.
Carmen Stagmiller, Board of Health member.
Okay, so first item on our agenda here is to go over the minutes from the June Board of Health meeting. Did anyone have any changes or comments to those?
No, I love AI.
Let's see, we do have a quorum, so do we want to make a motion to approve those?
I move. I second.
Okay, all in favor?
Aye.
Okay, perfect, okay. Minutes are approved. So I don't have any old board business on the agenda. So unless there's anything, we can jump into new stuff here. So we'll start with some updates from the health department, and I wanted to first just take some time to answer any questions or talk about what we're looking at for our seasonal vaccination season here. Things have changed a little bit, and kind of just run down our plan for you guys and try to answer any questions that folks might have. So as it sits right now, the ACIP did continue a recommendation for flu shots for everybody 6 months and older. So that will be kind of business as usual. The bigger changes that we've seen have been with the COVID vaccinations. So the FDA removed all the emergency use authorizations that we were using, under which we were administering COVID vaccinations previously, and then the FDA did approve some of the vaccines that are on the market. So the Pfizer mRNA vaccine is approved for individuals 12 and older, and then Moderna was FDA approved for, the vaccines that can be administered. The Moderna is actually, there's products in the market that can be used 6 months to 11, and then an additional 12 years to an older vaccine. The FDA only approved these vaccines for individuals over the age of 65 and individuals in a younger age category that have an underlying health condition. There isn't a ton of specificity on what those underlying health conditions are. It's a little vague around that still. And now where we're sitting right now, the ACIP is going to meet actually the next 2 days, tomorrow and the next day, to have a discussion about recommendations. I think some of the challenges we're running into is that, even if the ACIP, we're going to have some access issues for folks under the age of 65 for COVID vaccinations. So some of the issues that we're running into is that, even if the ACIP does say, okay, well, we recommend a vaccine, or shared clinical decision making, that you can talk with your doctor and decide if you should get a vaccine or not. Even if they open it up to that, this would still be, for individuals that don't have an underlying health condition, this would still be considered off-label use, and that creates barriers around insurance coverage of those vaccines, as well as potentially some liability issues with providers to be administering medications off-label, right? These are going to be pretty major challenges. We in Teton County, we are still planning to do a significant number of COVID vaccines. We have a pretty robust population over the age of 65 that routinely vaccinates. And so we went ahead and purchased less than we did last year, but similar number of COVID vaccine that we went through last year, assuming that our over 65 population is still going to want it. So when we do our drive-through clinics in October, we'll be offering both flu and COVID vaccine at those clinics for folks over the age of 65. In terms of vaccinating anyone under the age of 65, I'm not really sure what that's going to look like yet, which is a scary thing to say when we're 2 weeks away from going out and doing all of these vaccination clinics. I'm sure you guys have heard that many of the pharmacies that are offering these vaccines are requiring a doctor's prescription to be able to administer it if you're under the age of 65. That doesn't feel very feasible for us. Like, that still feels like we're not set up like a pharmacy to be receiving prescriptions from providers. That just doesn't feel like a very likely scenario for us at the health department. I don't know if we'll be able to put in place a standing order that says, if anyone identifies as having an underlying health condition, that's sufficient, or if we'll need to just not administer to folks under the age of 65.
That will
If
be a
it
barrier.
helps.
Yeah, tell us what you guys are doing.
In Washington State, I'm still the medical director for an outfit that does vaccinations based on a state program. They're an EMS unit, but they go around with a truck, right? And so what we've done is given them a standing order for people under 65 with a short list of things that the American Academy of Pediatrics recommended. And I just kind of said, okay, I'm willing to accept this liability. You guys can do these. It might be something similar here if that's something that you guys want to seek out.
Yeah, and I think that there will be a lot of, I think there will be, I'm just looking at Gary because he's the one who signs our orders. There will be a lot of local jurisdictions that are, some states are going through the process of like saying, okay, we're going to create a statewide standing order that everyone can operate under. That is not going to happen in the state of Montana. And so it's going to really fall down to individual jurisdictions. And so it's definitely something that we can discuss. I think, the reality is I think there still could be some question by insurance companies about whether or not they're going to reimburse for this.
Right.
So that's something we want to be mindful of. That said, we've purchased the vaccine and it's going to do more good in people than it is in our refrigerator.
Or outdated.
Yeah. Yeah. So, I think that that's something that I would consider in terms of our, when we're thinking about our overall budget and that kind of thing. The amount that we've purchased 300 doses of the adult vaccine, and I think that we will have 300 people over the age of 65 that want it. I think that would be pretty typical, maybe on the low end of typical for what we've seen over the last few years for Teton County. So I don't know if then, we just hold off and we don't administer to anybody under, I'm definitely open to a conversation about it. We of course we want to make things accessible to people. As far as I know, I don't know that any of the other facilities in town will be offering COVID vaccines. Do you guys know if you're going to be carrying any
I
for
need to
patients?
find out. I hope so. That was the other suggestion I was going to have is I guess assuming they actually show up, right, is always the problem. But you could always then bounce them over to BTMC and we can see them briefly and say, yes, this person needs it. And I can give the order for it.
Absolutely. I think it would be a lot more streamlined for, like, if you're their provider to also be able to vaccinate folks.
And I can make sure all my providers understand these are the guidelines.
Yeah.
Right on the flow chart,
Yeah.
Now, do you work benefits TMC?
And Carmen, are you guys going to carry any?
No, we're not, but we would be willing, depending on the circumstance, probably to write an order and send them your way.
Okay.
I was going to say that'd be the other option is I could come up with something that says we strongly recommend this child be vaccinated based on this, and then they bring it over. I don't know.
Yeah.
That would work,
I don't know. We've never had to do anything like that where we're always operating off of standing orders, and so to be like creating a situation where we're requiring individual documentation from folks about conditions feels just challenging, I guess. New for sure.
So is the ACIP, is that a completely brand new board? Are the members brand new?
Yes.
There's nothing, there's no carryover?
I don't believe so.
Flu shots, are you gonna do them with the COVID? Did
Yeah.
you purchase 300, or same
Oh, no, we purchased probably close to 900 flu shots. Yeah. Yeah, because, and so with flu shots, we'll go, and I can pull up our schedule.
Because 6 month and older, you're gonna get younger.
Yeah, we'll offer those for, so give me just 1 second here and I can pull up, Katie just sent it to me yesterday, so let me just pull it up and put it on the screen here. Oops. Okay, so this is what our, sorry, it's not very pretty, and Carmen, I can try to share this so you can see it too. Okay, so this is basically what our schedule looks like. So the first week in October, we're going to hit our long-term care facilities. We haven't heard back yet from Front Range Assisted Living in Fairfield. Last year they used Fairfield Drug to do those vaccinations, and so if that's what they want to do again, not a problem.
Which that's what she said she was checking into.
Yeah,
so
she's
we
looking
just haven't
into
had
it,
the
so we just
follow-up
haven't heard for sure
conversation.
if they want us to come or not, but we'll fit that into the schedule if we need to. We do, and then on October 2nd, we'll be going up to Bynum, Rockport and New Rockport, and Miller colonies. We do a special one for Three Rivers just for their employees. And then on October 7th, we're going to be kind of starting our rotation of community and school clinics. So we'll be in Fairfield School October 7th, and so that's just students and staff at the school, and then we'll be in the parking lot of the Fairfield LDS Church for a few hours for a drive-through clinic. We'll repeat that in Choteau on the 8th, so the Choteau School for students and staff, and then we'll be outside the pavilion as we have been for a few hours on October 8th. And that's usually our biggest drive-through clinic. We usually do around 200 people on that day. Then the following week on the 14th, we'll be in Greenfield, and then in Power at the Senior Center for community clinics. And then the 15th, we're going to go to Power School, Dutton, Brady, and then the Sunshine Trail Lodge there in Dutton, and then we'll do a drive-through clinic in Dutton as well. So, yeah. So I mean, it's a busy schedule. We're out a lot. At all of the ones I think that are highlighted, those are our drive-through community clinics. We will be offering both flu and COVID at those clinics. When we are in the schools, because we really don't anticipate seeing a lot of people over the age of 65, we are just going to be doing flu in the schools.
Right.
And then, of course, at our long-term cares, our congregate living locations, we will offer flu and COVID to those folks that qualify then as well.
Are the colonies more receptive now to those vaccinations?
Yeah, I mean, Rockport and New Rockport we have great vaccination rates there.
Rockport was receptive. When I was a director, we went out to, this is during H1N1, that particular situation, and we had been very successful at vaccinating the colony's residents, and they really liked us, and we're so excited when we came out and things like that. And then we were having H1N1, and we went out there to vaccinate, and they had gotten a document from their relatives in Canada, and it talked about how something was included in the vaccine, an implant or something, and they really recommended them not to get the vaccine, and by golly, they held on to that document for dear life, and we really had a decrease in vaccinations from the New Rockport and Miller.
And Miller's tentative. I've reached out a couple of different ways to ask them if they wanted. It's on the schedule still, just because if someone calls back, I wanted to make sure I knew which day we were going to do that. The other two are confirmed, but Miller is. Yeah. I haven't heard back from him, but this is this is our internal schedule.
This is, right. This isn't like we haven't the Teton Adventist School isn't on here. Front Range Assisted Living is tentative. Like we try to make sure that we're reaching out and offering it to everybody. Not everybody says yes to us.
And the Teton Adventist School, same thing. I've talked to two people there. They're coming back to me if they wanted. So and I didn't put them on because the other one, anyways.
Well, they're right in town,
so I wasn't worried about squeezing them in. The other two take travel time, so I put them on for the days that we'd be in the vicinity if they wanted it to kind of mentally map that out.
So you see that are you seeing like a hesitancy for the COVID vaccine, but you seem to be anticipating pretty much your average for flu?
So I guess what I would say is that we have seen a slow decline in flu vaccination year after year. And that could be for a lot of different reasons. I feel like in talking to my other public health colleagues across the state, they're seeing similar things, similar trends where less people are getting flu shots. We're planning for about the same, maybe slightly less. I don't anticipate that we'll run out of flu vaccine this year. I think we ordered plenty enough to cover. This could also be that like flu vaccines have become more accessible other places too, and so people are going and getting them elsewhere. I really don't have a way to know that information. If they're getting them at their healthcare provider, if they're getting them at a pharmacy when they're in Great Falls or something along those lines. Like Fairfield Drug now offers flu shots, you know. So there are other options for people to get flu shots. With the COVID, I guess I don't know. I mean, I think there's always been some level of community hesitancy towards them. I'm still anticipating that people are going to want them. We are getting calls, mostly from our over 65 population, but we have been getting calls all through the last month for people wanting to know when is it going to be here, when is it going to be here. And so I am anticipating that we will see actually fairly similar numbers in our COVID vaccination. What is going to be missing is, again, the people under the age of 65, which wasn't by any means the majority. I think last year we used like maybe 12 pediatric doses. So, you know, COVID vaccination rates among children is low. You know, and there was a significant population of adult population that would get them, but not nearly as consistently as the folks over the age of 65, if that makes sense.
So have you seen any decliner in children's vaccination levels? Any hesitancy? That's obvious.
Yeah, I think we do see, what we see is more parents vaccinating on like a customized schedule, or choosing certain vaccines that they're not going to be doing. It's hard to say because of the way, every school used to have to send in an annual report on their vaccination rates, and schools are no longer required to do that in the state of Montana. So we don't actually have amazing data on this. Like, we know the families that we vaccinate, but we don't have great data on a community level anymore because the schools are no longer sending in reports.
So unless they come in and get in the system, you don't know the children that are out there that may not be getting vaccinated.
Right, like if we never interact with somebody, we may not know that child exists.
Yeah, there'd be no way to know.
Yeah.
I think
It's not uncommon. We'll get someone who will come in to the ER or into a clinic and they'll be completely unvaccinated. So
I think
I never saw that before.
The reason I was asking that, I think we used to get a report from the hospitals when they had a birth.
Yeah, we did. We did used to get a report from Benefice in Great Falls every time they had a birth. Not from every hospital that Teton County babies are born in, but from Benefice. But we no longer get those reports.
It should still go into the state database, though.
Yes. Usually those babies do go in there. But yeah, I mean, again, if they never interact with the health department, we don't really know that they're out there. And then again, with the lack of, most kids go to public school, but without having to do those reports, like we still do go in and verify vaccination records with several of our schools. They ask for help to do that because schools still have to have vaccinations on file for each of their students. They just no longer have that like accountability piece where they have to report to the state.
And even if like the babies are getting entered into NTRACs at birth, right, because they've gotten that Hep A one maybe, it's owned by Benefice. So when I go in to do our recall reminder, it's not owned by Teton County unless they've come and seen us. And so like even if they are a Teton County resident, and like if that was a method to try to get a hold of babies because it's not in our like block that we own, I can't send out recall reminders to them. Does that make sense?
And it's been that way for a while? I'm just trying to remember how we always knew.
Well, the reality is we probably didn't know exactly, but we had a pretty good idea, mostly because of those school reports. Like we used to get sheets in the mail from Benefice about every time a baby was born. And then we would have those annual reports. But like, we still probably didn't know with kids that were homeschooled. Like, we never,
Oh, yeah.
we never had perfect data on vaccination rates, but yeah. But it is harder to obtain now. But I mean, yeah, I think we do see a trend where people are sort of picking and choosing, you know, what they're doing. Or vaccinating on a different, sort of their own schedule.
So one of the early indications of what's going to happen the next couple of days, they're going to pull Hep B on infants. So would that affect us much, or the health department?
They've been pushing that one for years now too. I don't know why they're doing that, but yeah. I wonder what's next.
What's the schedule on Hep B now for kids?
I haven't seen the updated one, but I can tell you what it used to be, of course, you know, but.
Birth dose.
Yeah.
There's usually a birth dose and then
Typically.
2 months, 4 months.
It's worked in with that, okay.
Yeah, yep.
Yeah.
Yeah.
Used to be the biggest killer of physicians, by the way. When I was in med school, yeah.
The question I often get is, well, why would I vaccinate my kid against something sexually transmitted? And then, you know, that turns into a 45-minute discussion about it's not necessarily, you know, yeah.
I used to get, I
I was
used to
going to
get
say,
that
the
for
other piece of this
HPV.
too, I think, is that's where, you know, providers come in, is they should be, you know, you see the well child at 6 months or whatever, you ought to be checking, okay, are they up to date, or my nurses should be. I don't know that that's happening universally.
Yeah, and I think for you guys specifically, when Dr. Amthor comes up, she's pretty great about knowing her patient's vaccination status, and we get a lot of those parents that will come directly from an appointment with Dr. Amthor over to us to say, hey, can I get vaccinated?
Yeah, there's a catch up or whatever.
Yeah.
Yeah, I'm gonna review that with my team.
Awesome.
You know, this needs to be happening for
That's
every
great.
well child check.
Yeah, and I think we're so happy to like try to accommodate that as best we can, so that they don't have to come over for 2 separate appointments. Like, they can go to you guys and then come to us right immediately
Sure.
afterward, as you know, as much as we can accommodate that. So just to make it easy on the families.
Are you the medical director then?
Frightening, isn't it?
No, I'm excited.
Somebody made a mistake.
I'm excited to have someone that supports vaccines.
Well, yeah, I'm family med trained. Dr. Borland was ER trained, and so I'm a rural trained doctor, so I'm trained to do ER, you know, OB, you name it, you probably know. So and I did a lot of pediatrics in training, so.
And you're accepting patients?
What other questions do you guys have? I do have.
So
Go ahead.
you'll have to excuse my ignorance here. These are, when they come, say to the Choteau one, do they have to pay? Is it through insurance?
Yeah, so
County
we
provide
bill insurance,
Okay.
and also with, I'm sorry, I forgot to pass out a
Because
agenda
they'll
to you guys, I'm
they'll
really
have
sorry.
to tell patients, hey, they're gonna be.
Yeah,
doing
so
it.
we ask everyone
Okay.
to bring their insurance cards. We
Okay.
also partner with the Blue Cross Blue Shield Caravan, and they will cover vaccinations for anybody who is uninsured or underinsured.
Oh, terrific.
So basically,
Yeah, way.
nobody should have to pay for a shot if they come to one of these clinics.
Okay, so one way or another, they'll be
Yeah,
doing
we
it.
will figure
Okay.
out a way. If somebody comes and wants a flu shot, or, you know, we will figure out a way to make it happen for them at no cost, so.
Perfect, okay.
Okay, and then the last thing I have on here, or just under this communicable disease piece, is measles. Just to give you guys a quick update, I think we're at 31 cases in the state right now in, I don't know, 6 different jurisdictions. You know, we've been fortunate to not have identified any cases in Teton County, which we're very grateful for. We've obviously had exposures in Helena and exposures in Great Falls, so it's nearby, exposures in Havre, but you know, now that school's back in session, of course, this is something that we worry about again. We are, as Katie's been going through and working with some of the schools to kind of review vaccination rates, we're trying to encourage the schools to know vaccination status of students and staff in case they did have an exposure, so it's quick to know who we might need to exclude from that school setting and who is already protected. So trying to think through that stuff ahead of time so that we're not wading through piles and piles of vaccination records in a school setting is kind of one of the things that we're trying to do ahead of time. yeah, just making sure schools feel, I mean, I think that's one of our biggest fears is that we would have an exposure in a school and that would be a big challenge. Similarly, like, working with our child cares to make sure that they feel confident in how to manage that situation were it to arise. And then it just feels like with measles, there's a lot of, a lot of different things could happen, a lot of unknowns. So we would just handle it as best we could. Yeah. Any questions about communicable disease or immunizations?
So there have not been measles cases in Teton County?
Not in Teton County.
Okay, that's good news. Yeah.
Yeah.
Has there been communication to other folks who might encounter these patients as an index patient where, they know, oh, this is what to look out for?
Yeah, I mean, I think last spring we had some great conversations with our healthcare providers about testing, and kind of worked through some systems about, okay, so if you do have a suspect measles case, where can we send people to do testing?
Right.
I know you guys are set up to be able to do it out in the parking lot so that nobody needs to walk into the facility.
Right.
We try to make that a really consistent part of any measles communication, that please call your provider. If you suspect you have measles, please call your provider first. Don't just show up in a waiting room. To sort of try to mitigate any of the downstream consequences of that. Similarly, we talked to Frontier Family Practice, and they have the capacity to do that testing outdoors as well, but I think would probably refer over to Benefits Lab. Carmen, is that what you think you guys would do?
Yeah, we're trying to, if we have sick calls, we screen, ask all the questions and if they've had their immunizations or not, and then if we need to move forward, we would, probably send to Benefis or test in the parking lot.
Yeah.
I think we would probably call you first and see what you want us to do.
Yeah, that'd probably be the best.
That sounds
thing.
great.
Have a nurse call our ER nurse and they can figure it out. Yeah.
Yeah. So yeah, I mean, I think we have a lot of the tools built. We've had some of the conversations. It's just one of those things where it's kind of it's measles, of course, is so different from what COVID felt like, because the majority of our population is vaccinated against measles. Like the vast majority of our population is vaccinated against measles. So it's a very, very different situation. However, I sort of remember having this feeling early in the COVID days of like we hadn't identified cases in Teton County yet, and so we were just sort of waiting and trying to figure out how to be prepared as best we could. And kind of constantly having these conversations. So it's good to just keep them on the forefront of everybody's mind, because you never know. Anything else on communicable disease?
Melissa,
Yes.
just a quick question. Once the ACIP meets and puts its recommendations out, do you plan to do any kind of further press release to help people know what's going on?
Yeah, I think my plan will probably be to have a nice long conversation with Gary about how he wants to handle things. And we'll see. I mean, I think I really don't feel like we can make it, we could decide something today, but I feel like it's meaningless until we know what the ACIP is going to do. So we will wait for that to happen, and then we can have a discussion about how we want to manage that in Teton County, balancing access with, like the feasibility, liability, expense of all of this. So, yeah.
Keep me in the loop.
I sure will.
Something tells me the direction all this is headed is, you need to go to your provider and make a decision on your own, and they're just advocating any kind of centralized decision making. I don't know if you're getting a different feeling. It seems like that's where it's going.
Hopefully no big surprises, so.
Yeah.
Who at the state level is head of the immunization program? That would be the person that would be the point of contact, or?
Yeah, I mean, I think we have, Becky Kirschwainer is
she's still there?
Yeah. And I think we have a lot of, we have good support with the state's immunization program. However, they have about the same amount of information that we have. They don't, I think they do have some contacts directly with the CDC, but I don't know that anybody knows anything right now. Like, it's kind of just a waiting game for everyone to be making decisions. So, Yeah, but they are good about rolling out that information to us as promptly as possible.
Melissa, has the VFC, is that based on the ACIP?
Yes.
Okay.
Yeah, and so I think we have some, if my understanding is correct, we have some leeway when it comes to like our private inventory, but the VFC inventory that we receive will be dictated by, I mean, that's a federal program, and so it's gonna be dictated by the ACIP's recommendations. So that, you know, I
In
mean,
Washington State, it's gone. Essentially, they aren't able to use it really for anything anymore right now. It's just totally frozen over there.
the
so-
VFC?
Yeah, for by and large is what's happened because the state guidelines are so different.
Oh,
They're using the Academy of Pediatrics and,
Yeah.
you know, and everybody else, and you'll be, you know, the one for pregnant women, et cetera. You know, so it's just, they've essentially said, we're holding off on this, the state will pay for everything, which
Yeah.
is nice, but,
yeah.
yeah, we're in a different situation.
Yeah, that's interesting. And I think, so you're talking about specifically with COVID vaccination?
Yeah, mainly that,
Yeah,
yep.
yeah. Yeah, I mean, I would say we haven't
And
seen,
then
any
monkeypox
change
is normal.
at this moment in like routine childhood
Routine
vaccination.
Yeah.
The seasonal stuff, and we have not actually received our VFC, COVID vaccine. Or we've gotten our flu.
Flu,
now.
right.
We have our
And
VFC flu
Fluzone.
vaccine. We haven't received our COVID vaccine. I honestly don't even know if it's gonna come. Like, I don't know if it's gonna show up or not, so we don't have that inventory on hand. Whereas we do have a little bit in private inventory for the pediatric. And I guess I don't know if I said this, but all of our COVID vaccine is Moderna.
Oh, I was gonna ask, okay.
Yeah, yeah. I guess the last thing I would say around this is I'm sort of anticipating a rough respiratory illness season. I've been telling our staff, like, I don't really want to take on a lot of extra projects this winter because I think we're going to be busy. So I think it's just going to be a busy respiratory illness season. So we'll see.
How bad was flu in Australia this year, do we know?
What's that?
How bad was the flu season in Australia this
I
year?
don't
Do you have
know.
any idea?
Good question.
I'll have to look into it.
Katie, do you want to talk a little bit about our billing?
Yep. So we can pull them up if you want to see them, but basically the trend that I think kind of just draws home this idea that things are trending back down. Last year we had a slight bump. So we had, in 2023, we had about 65,000 in immunization billing for the chunk of time we're in right now. So January to September. In 24, it went up to 93,000 with the adding of like RSV, and then this year for the same time period, we're back down to 66,000. And so I would say that RSV bump is now trended back down, and we're close to what we were in 2023. And then the other thing that I was just going to bring up was we're on trend. We're on like 86. Most of them are at 86% paid for each month. With correction. So the ones going forward obviously are like at a lower percentage rate, waiting for some to come back. But for the most part, we're at 86% paid. We have the same for 2024. We're at the same amount paid out as for 2023. But there's still some more coming back, obviously, for 24. So hopefully that'll bump up in conjunction with us having 30,000 in the same window of time more. But there's more projects in the air, so it's a little bit harder to do some of those corrections. So I will try my best. We'll see what happens. But that's all I had. If you have any questions, I'm happy to open up stuff or show anything if you're interested.
Thanks.
You talk about FEP too?
Yeah. If you want to pull up that inventory I emailed you last night.
Oh, goodness.
It was like 10 o'clock.
Yet today.
It'll be up. It'll be up.
Here it is. Okay. Oh, sorry. Okay.
No, it's okay. That
This
bottom,
one,
yep,
yeah.
the Word document. And so as part of FEP, one of the requirements for our first quarter is to take an inventory of all of our emergency plans. And so I met with Dominic yesterday for about an hour, and then pulled up our own. And this is a rough like inventory. Like we have these in theory, like they're in there. I don't know if the wording needs to be changed or anything. This is the rough. These exist in whatever form they have existed for the last however many years. This is not a review of those individual plans. This is where they are at and what plans they are, if that makes sense. And so most of them are with DES, and Dominic shared them, so I actually have them on my computer and can pull them up if you're interested. And I kind of just quickly rough labeled them. So like our all hazards preparedness, DES has that one, and it has, which is the operations plan, emergency operations plan. Infectious diseases, us. Pandemic influenza is the health department, and medical countermeasures management is the health department. Then continuative operations, DES has chemical, biological, radiological, and nuclear. DES has that volunteer management. DES has a form of it. He didn't love it. So that might be something to revisit. And then crisis and emergency risk communications, DES has it. I put the health department is working on one like that. And so I also, again, like this is one where I think there's going to be a few plans where there is some health department overlap. And with this going forward, so the FEP has changed some of the requirements. We still have to go over some of our plans, but I think there's only 2 plans now that you guys have to sign off on. But I would be interested to know if you guys would be interested in reviewing some of these other plans, because I don't think they've been reviewed since 2018, some of them.
The world has changed since 2018.
Yeah, so, and I know, and this is partially DES, but there's some overlap. So I was just, I might come up with a schedule and you guys can say no, but I'll put the ones that definitely have to be reviewed on there. But it might behoove us to go over 1 or 2 of the other plans a year, just to kind of have an idea what's in them with your guys' expertise and with those conversations as pertains, from a health department view, because we are not DES, but it might be interesting to just hear if you guys have some ideas or thoughts for some of these. I don't know.
I hated writing those plans.
Yeah, I haven't minded them. I really I think it's been a good conversation builder with me and Melissa on some of these things. I mean, we haven't written, obviously most of these have had, the one we've written the most of is the communications plan together. The other ones have already existed, but I do think that there's value in talking out, especially since some of these haven't been changed very much since Dominic's done some work, so I don't want to I don't know, some of them have been worked on, but I don't know, there's some that maybe,
I think it might be meaningful, and I think, again, like what Katie's saying is meeting the requirements of our FEP grant, not hard. I think it's not going to be difficult for us to do that in terms of having these plans, the couple that we're required to review, that kind of thing. But I think what we want is, at the end of the day, a stack of meaningful plans that are user-friendly to us in the situation that we have to use them. And so maybe even pairing some of that, reviewing the plans, and then doing a tabletop exercise or something like that would coincide with it, so we'd actually have a chance to, practice a little bit. Might be a meaningful way to approach it, and that would be slow. It takes time to organize that kind of stuff, and so it wouldn't happen all at once, but I think that would be maybe a meaningful way to approach it, with bringing in the partners that are listed in the plan and trying to actually talk through the scenario.
Because those are old. Because I've been gone 10 years.
Yeah, well, and I think a lot of the plans,
don't
the
know.
pandemic flu plan, we update that, our infectious disease, those have all been
Some of-
updated really routinely, but some of these have been housed with DES, and not to say that they haven't touched them, but I don't know that they've had a big overhaul in a long time. And I think we've really tried to move our focus from okay, does the plan check all the boxes, to is the plan usable?
And I would say even if Dominic has said he has worked on some of them. So again, DES definitely has worked on them. So 2018 is a little bit of a misnomer, because some of them has been reworked with Dominic. But I think what I could see too is from a health department response, is this functional in our plans too, right? These are things that we have to we're going to be a part of. So knowing these plans and being able to recognize where we fit in and those things are something that I would more confidence in. And so I don't know, I think that's part of it too, of just working it in there a little bit.
I borrowed the format from someone else, and I liked that format because it wasn't just paragraphs of what you need to do. It was real specific.
Yeah.
And so it was easy to read.
Yep. Yeah, and I think we've maintained that format, actually. It's a good format, so.
Yeah.
Yeah.
Any questions or anything, or? Okay. Yeah. And again, DS definitely has done work on it, so I don't want to take that away. I just, in our realm, I guess, would like to do some work on them.
Some people like to do plans. Someone goes to work and goes, God, I gotta do plans today.
Okay, I'm just gonna share with Carmen one more time here. Okay, so I just wanted to pull up for you guys, we recently, in July, we just recently completed our health department strategic plan. It's pretty short and sweet, it's up on the website. It was a really positive process. I think we all got a lot out of it. We kind of came up with 3 different strategic directions. The first one is just like, outward, building trust with public health, building partnerships, awareness of the services that we're offering, increasing our internal capacity, like through staff trainings, through better systems within our health department. And then the last is integrating data and performance. This is all around kind of making some data-driven decisions and doing a better job of tracking like program performance, that kind of thing. So I'm not going to read this to you guys, but you guys, I just wanted to bring it up to your attention here. But you guys are welcome to read through this. But really, again, looking at doing sort of more outreach in the community, building those partnerships, strengthening those partnerships, improving referral systems. There's some alignment with the CHIP that we accomplished earlier this year in Teton County. And then, this is kind of building workforce, that sort of thing. Figuring out, I feel like we've been, we are in a very small building, and that has limited our capacity in many ways. And so when we move into the new building, I think it will be a great opportunity for us to rethink workflow, and what our positions look like. And then we're currently working on a performance management system, so we have better sort of reporting out on how well our programs are functioning. We also have been spending a ton of time on an organizational communications plan, so that we can be a little better about how we're communicating information to the public. So those have all been really helpful tools. But anyway, just wanted to bring this up to you guys. Go ahead.
I don't. So when I was there, but right when I left, there was a real push on health departments being accredited, which meant they met certain standards. And so in Montana, there was a lot of the larger health departments that went through that very tedious process to get that distinction. And the smaller health departments, it seemed like it was really a big job. And so there weren't that many smaller health departments that were accredited. So is there still that emphasis on accreditation?
Well, sort of.
Has it kind of
10 years
switched?
later, it's the exact same situation. The larger health departments are accredited, and I think there's maybe 7 or 9 health departments across the state, including the state health department, that are accredited in Montana. So smaller health departments have really struggled to achieve accreditation. What they offer, what FAB, the Public Health Accreditation Board, offers now is a separate type of recognition called pathways recognition. And that is I don't know if you remember, they kind of always talked about like accreditation light. Like it's like not the full amount of documentation, but like a smaller version with some of those really essential pieces. And so pathways is more achievable to a smaller department. The Montana Public Health Institute and DPHHS received some funding to do some pathways cohorts with jurisdictions in Montana. And so we are actually participating in the second cohort. So the first one went for 2 years, and now we're like not quite a year into the first, the second cohort, not quite a year into it. And this is helping us go through and complete things like our CHIP, our strategic plan, our communications plan, our workforce development plan, quality improvement, performance management, like all of these things. And every month we meet with our cohort and we have discussions and kind of get some of the pieces that are required for that pathways recognition. So at the end of 2 years, it's not required as a participant in this cohort, but we will be in a really good position to be able to apply for that pathways recognition. And that's really just like, whereas accreditation is kind of this ongoing thing, you get accredited and then immediately start to build your documentation for the next time around, Pathways is really considered just like a snapshot in time, like we were you know, we've achieved these things as a health department. And Katie's been a really big help with the pathways stuff. And I think, I mean, it feels like it's actually going pretty well for us. Like it's a lot of stuff that we've talked about doing for a long time in terms of like having policies and procedures in place and getting some of these documents finalized. And it's been a good push to get us to be doing things a little bit more consistently, maybe. Would you say?
It's good. I agree. I think like I really have enjoyed the experience. I think it's been helpful, broad picture, helpful for me at least, to like think these things through. And I think like, I don't know, we've had a lot of conversations around like what our goals are for like making sure things are like strategically organized, right? Like, and I'm a systems person, so this is very much right up my alley, and I'm really enjoying it.
That's interesting how it's evolved.
It really has. It's constantly, yes.
In fact, it was something that I really didn't want to do, and I really don't have a lot of the acumen to do that type of thing. And that was one of the reasons I hired Melissa, was to do that.
Yeah, and 10 years later, we still don't have it done, but we're getting closer. Okay. Any other questions about strategic plan or pathways or anything? Okay, I'm gonna let Claire go ahead and talk about behavioral health then.
So if you guys remember, Teton County was awarded the near-term initiative grant from the state. So it's $250,000 over the course of 2 years. And so part of the requirements for that was to meet in person at least twice. Melissa and I had our first in-person meeting last week, where we went over some of the deliverables that are associated with this grant, what we need to do, and just a lot of discussion with the counties that are participating in this cohort. Part of that conversation, actually a large part of it, is the sustainability of a behavioral health program coordinator. So my role that's in this. Because if you look at trying to put this kind of work with someone who's already full, or just someone who's going to volunteer, it's most likely not going to last very long. And so part of our conversation with Montana Public Health Institute was, how do we make this sustainable? How can we work with you guys so that we can show our legislature, like, this is important work, and eventually, hopefully, is funded, right, down through the state as like to the local, to support a position that's going to be paid to continue what we're doing. And so they have a lot of ideas that I think, well, we kind of like come to fruition as we go through the next 2 years. Part of what they are doing is what they call storytelling. So they're doing like in-person interviews. They did the first one with us there last week, where we're discussing why we applied for the grant, kind of what the culture of our town is. They went into like, some other little things too, but they're taking these interviews to eventually show those who are making decisions for us, like, this is why this work is important. And they've offered to help with like some interviews at like each local county that's participating. So that was like one of the big conversations at that meeting last week. We also talked about crisis, which is in everything. So not only do we have our North Central Crisis Coalition, where we meet once a month, we also talked about crisis at the Near Term Initiative meeting as well, because everything goes hand in hand, behavioral health and crisis. And sometimes you're in crisis and sometimes you're not. With that, there's just, I feel like it's the start of a lot of conversations, and there's a lot of like moving pieces. And so I have a lot of thoughts going on in my head, and I'm happy to answer questions, but I think I could probably talk about this for a really long time. So I won't get too far into it. You did see that we did a strategic plan for the health department. We also are updating our strategic plan for the CARES Coalition, the local behavioral health coalition we have here in Teton County. And so we did our first meeting with Jen McCauley. She is our TA for the NTI grant. So we utilized her services to help with this. And it was a really great conversation. And a lot of what came from that meeting with the CARES group is very similar to not only the health department's strategic plan, but our CHIP as well. And so as of right now, and the wording might change for the 3 priority areas, but we have like community connection, we have crisis, and then we have
Access to services.
Access to services, yeah, which will also include treatment too, because that's a big piece that's been coming up as well. So that's not finalized yet. We're still waiting for a post survey after the strategic plan meeting, and then we'll send that out to all the CARES members, and then we'll finalize over the next couple months and get that plan out.
So Claire, if it continues, what services will you be providing? You kind of spoke broadly about this program, but what
So
are the
when you-
specifics?
When you think about behavioral health, this also includes the mental health realm. So behavioral health, if you just look at like the basic definition, it's why do people do the things they do? And so what I'm providing, I think, is coordinating things like the CARES meeting. I'm the program coordinator for that.
And what's
So
CARES?
bringing in Teton County Community Alliance for Education and Resiliency Services. Support.
Resiliency and educational support.
There we go.
Yeah.
Sorry. Resiliency and education. Bringing in speakers, bringing in people like Carl Roston, who's incredibly knowledgeable on suicide prevention. He also has he's very up to date with like the suicide numbers for the state of Montana as well as like the nation. So providing the ability for not just community members, but service providers, or think about like schools, teachers, staff, admin, trainings. And it's like, so some of the things that I'm working on now with this NTI grant is working with MSU Extension. So it's like increasing the partnerships with the people we already have here to provide, when it comes to like community connection, work on positive community norms. So activities that are going to like bring people together to try to combat maybe depression or whatever it is they're going through in this very low stakes way, we'll say, right? So Get Your Kicks at 6 is based on something like that. It's a positive community norm. That MSU Extension has been working on for a couple years, and they're going to continue it next year as well. So there's like that piece. There's the crisis, working with the North Central Crisis Coalition, where it's bringing in trainings for like our first responders, including like the volunteer firefighters, making sure our sheriffs feel like they're equipped to handle the mental health crisis. We just had a meeting yesterday actually, and Keith said about 15 to 20% of his calls are behavioral health. And behavioral health and mental health really go hand in hand. And so I think it gets really confusing when we use terms like behavioral health and then mental health, because it's like, what does this mean? And it's like, it's really associated with why do people do the things they do, because a lot of times it might be self-medicating. So it's making sure our bars, like, are you RAS trained? Like, are your workers who are there responsible alcohol service people, right? Can they recognize the signs? Because they're going to be getting a lot of people in. And like you think about the Legion, it was formed for veterans. And a lot of veterans have maybe PTSD from stuff. And so I think the terms are really hard to like, I think, describe at times, because they can be a little bit vague. But mental health and behavioral health go hand in hand. Mental health is kind of like, behavioral health is behaviors while you're doing the thing that you're doing.
Behavioral health, so I think it's important to recognize the difference between health, because we have these terms of public health and health behaviors, which is typically where we talk about, are you eating nutritious food? Are you exercising, right? These are health behaviors. Behavioral health is an umbrella term that has been created to be inclusive of substance use disorder and mental health. So those two things together under the realm of behavioral health, because you can't separate them. There's too much overlap between, in terms of the services that people are receiving, in terms of the root causes. When we talk about behavioral health, we're talking about both substance use disorder and mental health.
So if you were to continue to get funding, what type of programs do you see might be offered in the school setting?
So I want to clarify something about what we're advocating in terms of Claire's role here with this near-term initiative grant. So behavioral health it's everywhere. Just about every agency you talk to in Teton County, they have some role in addressing behavioral health. If you work in healthcare, if you work in mental health, obviously you're going to be identifying individuals who are dealing with behavioral health struggles. But if you work in law enforcement, if you work in EMS, if you work in a school, you know, a lot of business owners would say that they're dealing with folks that have behavioral health issues as well. And so it's everywhere. And so the role that we've sort of identified at the health department, and we actually, Teton County has a very long history of doing this work in this way. And I think the rest of the state is sort of trying to, like, this NTI grant is a pilot project to bring health departments, public health to the forefront of facilitating a conversation about what it looks like to address an incredibly complex issue from a very multifaceted approach. And so the role of our, you know, behavioral health coordinator, who goes by many different titles, sometimes it's prevention specialist, sometimes it's, you know, dedicated change leader, sometimes there's all kinds of titles that get put on this role, but essentially is bringing together all those partners so we can have a cohesive and aligned conversation about how we together address behavioral health in Teton County. And what we found is that public health is really poised to be able to do this work because we have these partnerships with a lot of these organizations, and can bring them to the table in kind of a neutral way, right? Like we don't, it's not really what we do. Like, we don't do behavioral health work. We're not treating people for substance use disorders. We're not necessarily identifying a mental health struggle. All we're doing is bringing together not all, but what we're trying to do is I'd say the high level work that we're trying to do is to bring together all those partners that play a really important role in addressing this and making sure that they're talking to each other, that healthcare providers know about, you know, what's going on in the schools, what kind of referrals can be made, who's out there providing, you know, specific mental health care, what options are there for, you know, substance use disorder treatment. Also, how do we support people on kind of a holistic, you know, basic needs sort of level? Can we make sure they have food from the food pantry if they need it? Or can we make sure they have access to, you know, safe and reliable childcare or parenting classes or wherever people are at? Like, all of this impacts their behavioral health. And so our role is less about providing the services and more about bringing the partners together to make sure we're having those conversations.
So it's a lot of facilitation and coordination.
Yeah, I would say, you know, people still don't understand public health. And they'll tell me, well, what did you do as a public health director, public health nurse? Because I do have a background in nursing. And even the whole COVID thing, they don't have any idea. And so when you talk about behavioral health, they have no idea what behavioral health is. And so I think my recommendation would be more specific about how these programs would impact the people that you hope to serve. Like Melissa just gave some examples. And so that would be my suggestion to you, because behavioral health is, a lot of people would not be able to tell you out in the public what behavioral health is. You know, we get caught up in our own language and we don't realize that that other people don't have any idea what we're talking about.
And I think the term itself, behavioral health, I think came out of a place of trying to destigmatize mental health and substance use disorders. Like, when you talk about mental health, when you talk about substance use disorders, those are immediately stigmatized. Behavioral health less so, but the flip side of that is nobody knows what that means.
When we have a lot of programs. Teton County has been doing really well for a long time.
Well, you know, and I would talk about the programs that are, you know, available. They might be able to, because that's where people are going to, I think, support it. Because when they can see how this behavioral health program, what it actually does in this environment, like the school. Like, maybe we do suicide prevention, maybe we do, you know, talk to these kids, or what, you know, that type of thing. Or what do you do with law enforcement and how you work with law enforcement, the specifics. Because I'm sitting here and listening to you and not really understanding what this does specifically. And so, and I would support your program 100%, not knowing what you do specifically.
Well, I apologize. I think I was confused by what you were asking. I'm like, are you asking what programs we currently have? I think you were just trying to get more information.
I'm just trying to take it down to if you were to explain it to a lay person, or someone that might be in opposition to it. Because,
Hey, Melissa.
Yes, Carmen.
I gotta go see a patient, but I'm wondering if you could maybe include us in the clinic with your first responders and sheriff's department and those education pieces, because we tend to
Absolutely.
deal with a fair amount of that, and
I can only
could always
imagine.
use more education when it comes to that, so.
Yeah, yes, absolutely. We will make sure any trainings available to, first responders, you guys get included in that too.
Okay, thank you. I gotta go see a patient.
Okay,
Bye,
thank you for
everybody.
being here. Appreciate it.
Bye.
Bye.
that's just my
Yeah,
suggestion.
no, it's a good one. So, but yes, we do have there's a lot of facilitation coordination, so work with the schools. We have a lot of PAC schools, which is great. Bynum's one too, didn't know that.
I think not, did we talk about RBHI last time? In June? I can't remember. It probably we did
I think we
because
did.
we were working on it. But
Yeah.
I will say that it feels like one of our major successes in the last year in terms of our behavioral health work. So RBHI is the Rural Behavioral Health Institute. They go in and they do universal screenings in schools that participate. So it's like a quick few minute questionnaire, maybe 10-minute questionnaire that kids answer, and they can flag kids that are having some signs of suicidal ideation or have in the last, 60 days or something, 30
So,
days?
yeah,
I
it's
can't
like
remember.
3 months, it's like 3 months, 30 days, 3 months, and then over their lifetime.
And Claire put in an enormous amount of effort and got 5 of our schools,
5.
5 of our schools signed up to be utilizing RBHI, which is a really big deal. And I think when we talked about it, like, schools are funny because there's so many things that get thrown at them, like, you should do this, you should do this, you should do this, and they get like overwhelmed. And so we really try to be mindful about what we're pitching at our schools in terms of their participation. This really felt like a game-changing service. So this organization, RBHI, helps, there's somebody in the school that's trained to be able to do the screenings, and then when a kid gets flagged, they are linked up to services within 24 hours. Like they will help them find, if it's a red flag kid, they will help them and their parents get linked to services very quickly.
There's a lot of communication with
See,
it.
that would be, that, people can relate to that.
Yeah.
I think, so
Yeah.
what you're asking is actually, you just want to know specifics. You want to know specifics instead of like the broad term.
Yeah,
Because what
and I
I
think-
was understanding was to share like broadly what we're
Oh,
doing. Because
yeah.
if you wanted specifics, like I'll sit and talk with you, but we've had a lot going on.
No,
Like,
that's
there's a
fine.
lot going
I'm
on.
just saying that if you're explaining this to a layperson,
Mhm.
I think specifics would be, and maybe you do.
And it is different.
Yes,
But when I'm
yes.
talking to the Board of Health, we have limited time.
Yeah.
There's limited time. And so I think I was looking overarching as opposed to, here's this program we did in Fairfield, and we did this in Power, and we did this
Or
throughout the
even
county.
as giving examples.
Mhm.
I mean, like I said, I had no idea what this behavioral health.
Mhm.
So you're using I've been gone 10 years, and there wasn't this type of focus in public health
It's
at
true.
that particular
Mhm.
time.
It's true.
And so when you talk about behavioral health, I'm thinking, now what exactly is she doing for behavioral health? So that's,
Yep. No, and that's fair, and that's, it's good information too when I'm talking just to people in the
Yeah,
public,
but
which
just throw
is
some
very
examples like
different.
that's a great example. Who
Mhm.
can't get behind suicide prevention in school? Yeah. Thank
So
you.
I'll be more specific next time.
Thank you.
Yeah.
Okay, anything, I'm gonna give since we no longer have a sanitarian in Teton County, I
Oh.
can give a very brief update on that. Austin left at the end of August, and the commissioners are working on, I think, hiring a contract sanitarian to come in and provide services. So I think that looks promising, and hopefully that will be in place soon. I just had a meeting yesterday with a couple of folks up at the courthouse about how we want this to work. I will say that, like, we have felt at the health department, no surprise, we have felt his absence. We, have some phone calls getting routed to us that would normally not have been routed to us. But I think that this will work out okay, at least for the time being. When folks call, we're gonna try to support that work. Like, I think maybe I'll even grab some of the water sample cups and have them available at the health department so people can come pick them up here rather than needing to track down someone in the annex to be able to get those. That's kind of something that people do on their own. The sanitarian just made those available to folks. In terms of licensed establishments, if we get a contract sanitarian, they will take care of doing the licensing, inspections every year, following up with those agencies to make sure that, things are completed, that kind of thing. They will also take over that role with septics. Brian Colesworthy, the county planner, is planning to field the questions about that, and then maybe kind of have things lined up for a contract sanitarian to come in and just review things. So I'm sure there's going to be bugs, but we will work through a system. The health department is just going to take over the whole dog bite situation or animal bite situation, which before the sanitarian followed up with animals and we followed up with human victims of animals. But now we'll just take on both pieces of that. And so again, I think there's going to be some bumps in the road, but I think we'll be okay. I'm hopeful that things will continue to operate relatively smoothly, and we will continue to protect the health and safety of the people of Teton County. In talking with, again, our folks up at the courthouse, I think we really are interested in finding a permanent sanitarian in Teton County. A lot of counties are contracting sanitarians now. That's because there's just a shortage of them statewide. The position is posted, and I'm going to post it on a few more public health sites. But it really has behooved us over the last 10 years to have a sanitarian here and available in Teton County and able to be responsive to complaints or challenges or whatever is going on. And I think a contract sanitarian that's coming from, possibly a few hours away is going to be less responsive to those types of things. So if you know anybody who might be interested, it's one of those positions where there is definitely on-the-job training. When Austin started, he did a year as a sanitarian in training, working under another licensed sanitarian, registered sanitarian, and so I think we could work through that with another individual. But fingers crossed we find someone, and and it doesn't sound like that would be a problem if we have a contract sanitarian to.
What about educational background?
Yeah, so to qualify to become a sanitarian in training, you have to have 30 science credits. You have to have a bachelor's degree, 30 science credits, including, I know, at least one microbiology class. So somebody who went to school for science.
And what's the pay, do you know?
Yeah, we're gonna list it. I talked to the commissioners I talked to Joe about that yesterday, and Paula. I think they're thinking kind of I want to say they said like 50 to 60,000 a year based on experience. Maybe 55 to 60 a year based on experience. So that will be the range.
Is that pretty typical for a rural area?
Yeah, I think so.
It's not bad out here for somebody with BS.
Right, it's not,
Yeah.
and I mean,
Yeah,
county has,
school, yeah.
benefits and all of that,
Mhm.
so, it's, yep.
When I used to hire RNs, I used to tell them all the benefits of the job before I told them what they got paid.
Yeah, we still do that. Let me tell you why it's great to work here. Yep, so, any other any questions about sanitarian stuff? I think Austin did a nice job of trying to wrap up as much as possible. He did warn everybody that September can be a really busy month in terms of septics because everybody's trying to get them into the ground before things freeze. So I think there have been quite a few requests for that. So I'm sure that when we get a contract sanitarian, they will have a stack of things to deal with. But
Austin was a great sanitarian.
yeah.
Cool,
Do
calm,
they have
collected.
anyone lined up? Or they're just wanting to hire a contractor?
I think there's definitely a few out there that do this. Yeah.
Oh yeah, a lot of the Highline used to just contract.
Yep, I think they still do. Still have not been able to find permanent sanitarians, and now it sounds like there's other places too. Like there's a lot of, unfortunately, just I don't know why nobody wants to be a sanitarian. I feel like it's a great career path. You can go anywhere.
You're outdoors?
Yeah. I think it's because of the title. I think they need to change it to environmental health specialist. That would be a
then nobody
bigger
will-
draw.
Well,
Nobody wants to be called a
I
sanitarian.
don't know if you want to put environmental on there.
Anything else you guys?
How
want to
about
talk
saying keep the poop out of your water?
Right. Any other questions, concerns? Okay. We will adjourn then. Thanks,
Hey,
everybody.
thanks, Melissa.
Thanks.
So Claire, are you funded? I mean, through this, is there any money that still hasn't transferred out of this last
Well, there's definitely been changes in funding.